you. Greg Eisenberg.
Come on up, everybody.
Did we succeed? Yes! You did it! Over 156,000 signatures were collected by concerned Coloradans from every corner of the state and delivered to the Secretary of State's office this morning by ambulance on a gurney with Dr. Aguilar and Nurse Nicholson attending. And boxes and more boxes of petitions were carried by ordinary Coloradans into the Secretary of State's office to put ColoradoCare on the ballot. On behalf of every Coloradan who's needed health care, and for all of us who find that it's unaffordable to pay for health care, or who have needlessly spent money from their retirement funds, or lost college tuitions, or even homes, or futures. And on behalf of healthcare professionals who would rather treat patients than do paperwork. And on behalf of people who would like to have more teachers in the classrooms and more services for the aging and for the young. And on behalf of all the incredibly dedicated, hardworking, faith, service, and activist groups who now will be able, once this is passed, to focus on the other determinants of health, like decent housing, like adequate pay, like clean air and water, the other things that will make us happy, healthy and happy. I'm just beside myself. Thank you. So I want to remind everybody that Coloradans, we know we're fair, we're compassionate, we're inclusive. And we spend our money carefully. That's what we do in Colorado.
Yes.
Coloradans, we take care of our own. Coloradans take care of Coloradans. That's what we do in Colorado. I want you to appreciate everyone who's here and everyone who has or will help make this a complete reality. And I also would like to mention Dr. Ivan Miller, Ralph, Dave Beckwith and Bill Semple, who are not here, who are over in the Secretary of State's office right now with all of our precious signatures. All right, so I ask you, will we have health care for all the Coloradans? Will we save billions of dollars every single year? Will we have a system in Colorado that works for Coloradans? Yeah. Let's take it to the voters! Take it to the voters! All right. I would like now to turn this over to T.R. Reed. He's an international correspondent, a prolific writer and speaker, an expert on healthcare around the world, and in his unassuming, kind of really powerful way, he just simply said, let's do this.
Hi, everybody. I make Lynn go around the state saying that stuff about me. This is part of our deal. This is an idea, ColoradoCare is an idea that started with a fairly small group of people who were dedicated to the proposition that a decent, ethical democracy ought to provide health care for everybody who needs it. This is a fundamental moral imperative. It stems from the deepest bases of our Judeo-Christian Western culture We've learned from childhood that we need to care for the least of our brethren, and if you don't care for them when they're sick, you're not meeting your basic moral obligation. All the other countries like the United States, I mean advanced high-tech free market democracies, all of them provide health care for everybody. And guess what? They spend half as much as we do in the process. So the United States is spending more than any other rich country and getting less in terms of health care. We need to fix this. Now, Obamacare was a step. Obamacare did expand coverage, but guess what? It's left 33 million Americans without health care, including about 373,000 Coloradans don't have health insurance today. 30,000 children under the age of 16. Kids with earaches and toothaches, kids going to bed with an asthma attack because their parents don't have health care in our rich state. This is wrong. We should fix this. And the beauty of what we're proving today is we can fix this. We have a plan, ColoradoCare, and it's so effective that more than 156,000 Coloradans from every corner of the state have signed on to say, yeah, let's do this. When we pass ColoradoCare 13 months from now, we will be doing a huge service for our state. We'll finally get everybody covered, provide health coverage for everybody, and save billions of dollars in the process. But we're also going to be doing a great service for our country. Because when we demonstrate to the rest of the country that we can provide health care for everybody at reasonable cost, the other states are going to follow. And this is the way we're going to get health reform in our country, state by state. And anybody, you just look at American history, this is a tried and true, proven path to policy innovation, policy change in America. Many of the most important ideas in our history, female suffrage, free universal education, progressive income tax, interracial marriage, many of those ideas started in 1, 2, or 3 states. The rest of the country saw that it was the right thing to do and went along, and that's what's going to happen with health care. This is how the United States is finally going to get where we should have been a long time ago, high-quality health care at reasonable cost for every American. The route to that honorable destination starts right here in Colorado with a plan called ColoradoCare. We call it ColoradoCare because it's not Obamacare, it's ColoradoCare, designed in Colorado. And to explain the plan, let's call on the author, State Senator and Dr. Irene Aguilar. Doctor.
ColoradoCare exists because of Dr. Senator Aguilar.
Thank you, and the ColoradoCare is on the ballot because of you. So, first of all, I want to tell people this is not government health care. I've been in government, and we can't get health care done. This is health care of the people, by the people, and for the people. We all pay for everyone's health care, whether we intend to or not. Your insurance premiums are high because people can come in and get health care when they're sick and don't have insurance. But why are we treating them when they're in dire straits? Why aren't we helping them stay healthy and keep working? And so what ColoradoCare is going to do is have all of us pitch in together to pay the money that's coming in dysfunctionally from 50 different sources, which leads to administrative costs of almost 30%, administrative hassle leading to high provider burnout and patient dissatisfaction, and pool that money and instead just pay for everyone to get health care. Now, this is not going to be an easy fight. It's not going to be as hard as it is in the legislature where there are billions of dollars spent on lobbying every year. But it's still going to be a hard fight because people are going to want to try and scare you off. But I want you to remember 2 things. One is that This model has been tried at some form on the Western Slope. And we read all the time about how successful they've been on the Western Slope because you know what? They realize that at the end of the day, they're going to be taking care of everybody once they end up in the hospital. And so they work really hard to figure out how can they get people the care before they get to that point in time. And that's what we're going to do with ColoradoCare. Everyone will pay in, everyone will have access to the healthcare system, everyone will have their choice of providers, and actually we're going to say we're not going to pay unreasonable prices for things. We're not going to let finances keep us from managing our health and our diseases, and we're going to invest in prevention and keeping our population healthy. And I look forward to working on this initiative in the next year with all of you, to educating all of you so we can go out and talk to the people and get them to help get a success in November of 2016. Thank you. You know, when I said that this wouldn't have been possible without the work of you, I want to single out my good friend, former state senator and public health nurse, Jeannie Nicholson, who's been leading this campaign.
Here is a woman who gets things done. Oh my goodness. And she looks at the big picture, and you know how to put all the little pieces into the big picture to make it work. You know, Jeannie is a champion of people.
I had a serious infection and it required penicillin. I developed an allergic reaction to the penicillin and walked into my doctor's office, completely broken out in hives, and walked up to the front desk and I said, "My name is Jeannie Nicholson and I'm going into anaphylactic shock." And the woman behind the desk said, "That'll be a $20 copay." I've been licensed to practice nursing in Colorado for 50 years. I started out in Gunnison. And when people came to the hospital in Gunnison, when I was a nurse, we didn't ask them, "How are you going to pay for your care?" We asked them, "What's wrong and how can we help?" We thought the patient was the priority, not profit. With ColoradoCare, we can go back to that policy that the patient is the priority, not profit. Today, we are celebrating. That's what today is all about. It's all about all these people who have worked so hard to get over 156,000 signatures. So we can be on the ballot in November of 2016, and we can pay for health care in a new way that means every Coloradoan will have a Platinum Plus health care plan, and we will save billions, and it will be designed in Colorado by Coloradans for Colorado. Thank you.
Jeannie, and I understand, I mentioned Bill Semple and Ralph Ogden were not here, and I understand they brought a special gift. So Ralph, do you want to share, and then I'll introduce the next speaker.
I have in my hands a receipt from the Secretary of State. I have in my hands the receipt from the Secretary of State acknowledging that all of our petitions have been turned in, and they will start the count sometime early next week.
And then I want to introduce you to Chip Baird. He's the owner and CEO of Bojo's Pizza, and I just as an aside, I really love mountain pies. But he did what any successful businessman would do. He didn't just sign up to begin with. He asked a lot of questions. He ran a lot of numbers. Here's a businessman who made decisions with his heart and his brain. Chip Bear.
I've been in business in Colorado for over 40 years. When I first started in business, I really wanted to be able to provide health insurance for my employees. I felt that that was very important. I couldn't do it. There was just no way. Health insurance industry told me that 80% of my eligible employees had to sign up for the program. The only way in the restaurant business that was ever going to happen is that is if I paid every penny of it. There was no way I could afford to do that. So consequently, we couldn't offer that. ColoradoCare gives us a chance to make that happen. Today we can be able to, I have over 400, somewhere around 400 employees, and by just increasing what I pay for health insurance for 37 of my employees, I'm going to be able to cover all 400 of them. I have to make plans. I got to think about how things are going to work. And I really think that by being able to have a more efficient healthcare system, our system here in the United States is, we can do wonderful healthcare, but it costs twice as much as any place else on the planet. And that is just not right. We've got to do better. We've got to get rid of the insurance companies that say, you can go to this doctor, you can go to that doctor, but you can't go here, you can't go there. You can't have mental health coverage. The mental health in this country is abysmal. We have so many problems with that. We don't take care of it. With ColoradoCare, we're going to be able to take care of our mentally ill also, as well as paying everybody's insurance. They're going to be covered. You're not going to have to worry about going broke because you get sick. To me, that's the big picture. We have a healthy society that's going to bring businesses into our community. For most businesses, it's actually going to save them money, which is just going to be huge. So this is really a milestone. I'm really proud to be in front of you today and to promote this. And hopefully this is laying the foundation for a good healthcare system for the entire country.
Okay, October 23rd, 2015, a historic day in Colorado because this is the first day of our 13-month campaign to get health care for everybody in Colorado. But it's only the first day. So we have a very tough campaign to run for the next 13 months. And I just want to remind us, as we're making this campaign, of why this is such a powerful idea, why we're going to win. It covers everybody.
Yay!
At the moment, 373,000 Coloradans don't have health insurance. We're going to cover everybody. It saves billions in administrative costs. As Irene said, our administrative costs. Guess what? It gets us out of Obamacare. There's a clause in the Affordable Care Act, Section 1332. It says, if any state has a plan that covers as many people as Obamacare, you're out. No penalties, no taxes, no rules imposed by bureaucrats in Washington, D.C. We're going to set the rules right here in Colorado, and we're then going to set a standard that the rest of the United States can follow so that we get to the point where everybody in our country has health care. This is our campaign. It starts today, so let's get to work.
Irene, did you want to add anything? Or Jeannie, do you want to add anything?
The only thing I'd like to add is the quote by Margaret Mead, which says, "Never doubt that a small group of thoughtful, committed people can change the world. In fact, it is the only thing that ever has." And I'm so proud to be part of this with all of you thoughtful, committed people and the other 500 people who helped us collect signatures who couldn't be here today. We're going to get it done because there ain't no power like the power of the people. Thank you.
My final word is a thank you to all of those people that collected over 156,000 signatures across this state. We are so grateful to you for helping us to get a way to have health care coverage, Platinum Plus health care coverage for everyone in our state, save billions, and design it for people in our own state. So thank you so much for all your work.
Over 580 circulators around the state collected petitions, and many more volunteers helped in other ways. This is awesome. It's just inspiring. Before we get to some chants and some more music, I want to point out that for those of you who are members of the press, Ricky Haddow is right here, and she has some press packets with some information for you and can connect you with some people who are willing to do interviews. Also, I encourage all of you to stay in touch, and if you're not on our contact list, as TR suggested, we're starting now. And as soon as you finish celebrating here, I'd like you to jump into your car with your friends and drive down to Colorado Springs, and they have a celebration at 2:30. So, yay! Now I'd like to turn this over to Donna Young, and she'll lead you in a chant, and then we'll finish up with another song from Greg Eisenberg. Thank you. Thank you.
Morning. Would everybody...
You're on.
Okay. Would everybody who has one of these little slips of paper come forward, stand in a row in numerical order?
Oh boy.
This makes it easy for us. We want to tell you about ColoradoCare, and we'll do a little call and response here. ColoradoCare, number 1.
Everyone has lifelong health care coverage.
And everyone else, I'd like you to say ColoradoCare, yes.
ColoradoCare, yes.
ColoradoCare, reader number 2.
In good times and bad times, we always have health care.
ColoradoCare, yes.
ColoradoCare number 3. Whoa.
Make healthcare decisions with the provider you choose.
ColoradoCare, yes.
ColoradoCare 4.
Great comprehensive benefits without deductibles.
ColoradoCare, yes.
ColoradoCare 5.
Providers provide care. No more hassles with insurance companies.
ColoradoCare, yes.
ColoradoCare number 6.
Control costs, negotiates prices for drugs and medical devices.
ColoradoCare, yes.
ColoradoCare number 7.
Healthcare money stays in Colorado, creating jobs and a strong economy.
ColoradoCare, yes.
ColoradoCare number 8.
Access to health care all over Colorado. Supports community clinics.
ColoradoCare, yes.
ColoradoCare number 9.
Local election of Board of Trustees. Local input.
ColoradoCare, yes.
ColoradoCare 10.
Emphasis on prevention, early intervention, and wellness.
ColoradoCare, yes.
ColoradoCare 11.
Covers mental health.
ColoradoCare, yes.
ColoradoCare, yes.
ColoradoCare, yes.
Thank you very much.
Finally, I think it's essential that we recognize and thank the person who ran this hugely successful petition campaign with basically no resources, just the will to win. That's Lynn Gillette. Lynn, where are you? She was backed up by dozens of captains and hundreds of petition gatherers all over the state. They're the people, and you're the people who are going to lead us to victory in November of 2016. I just want to say, anybody who's interested, take a look at our website. I'll answer all your questions. And any reporters who are here, I'm a reporter. I'll be very happy to answer your questions after this event. The campaign starts now. Let's go.